Part of your responsibility as a school bus driver requires you to be prepared to act appropriately in emergency and crash situations. Today we'll be looking at general guidelines for a few common medical emergencies. It is your responsibility to check the first aid kit and body fluid cleanup kit on a regular basis to ensure it's present and ready for use. Make sure to familiarize yourself with its contents and how each item is used. As a bus driver, you cannot focus all your attention solely on the ill or injured student. You must consider many other factors, including hazards that make the situation worse, obtaining emergency medical assistance if necessary, the seriousness of the injury or illness, the safety of all healthy passengers, and of course, your own safety. Also, don't forget to report all incidences to your supervisor. Today's presentation is intended only to present some basic guidelines concerning your actions in a medical emergency. It is not a first aid course. It is important that an individual never attempt procedures that go beyond their training and qualifications. First, you need to know about confidentiality. Confidentiality laws are very specific. You may ask yourself, when do bus drivers have access to records or information? The answer is, when the information is used to fulfill your professional responsibility for providing a safe environment for the student. This means that you should have sufficient information so that you can keep the students safe. For example, you should be aware of a student's food allergies if you will be treating with food at any time. You also need to be aware that you may not always know the diagnosis of a student's medical condition. You could just be given information to keep the student safe. For example, a student's plan may state that they may not be given any food, but it doesn't give you the reason. Information could be given to you by the parent or guardian or the school nurse. No matter the source of the information, it needs to remain confidential. When information is confidential, it means you cannot share it with anyone or talk about it with anyone, including fellow workers, family, friends, or other students. The information may only be used for the purpose and in the context in which it was given to you. You may only release information in an emergency to appropriate persons to protect the health and safety of the student. Before we discuss some common medical conditions, we will take a few minutes to talk about universal precautions. Universal precautions are the basic hygienic practices used to protect anyone who may come in contact with body fluids. That would be blood, urine, feces, and vomit, all of which could contain germs. Universal precautions include proper hand washing techniques, use of disposable gloves, and cleanup procedures. The principle of universal precautions is to treat all body fluids as if they are contaminated. The bus driver must take the precaution against becoming infected, him or himself, or passing the infection to anyone else when helping a student. When responding to first aid emergencies that include blood or body fluids, the bus driver must wear vinyl gloves when treating students with wounds or vomitus and when handling blood-soiled items, body fluids, excretions, and secretions, as well as the surfaces, materials, and objects exposed to them. If surfaces are contaminated, the bus driver is responsible to see that the surfaces are disinfected. The last important part of the universal precautions is to make sure you wash your hands after removing the gloves. Next, we will give an overview of the potential medical emergencies that could occur. The following information comes from the October 2010 Pennsylvania School Bus Driver's Manual. By becoming familiar with this information, the school bus driver can respond appropriately if there is a medical condition. First, we will look at allergic reactions from bites and stings. Bites and stings can result in allergic reactions. Bees, spiders, and wasps are some of the creatures that can bite or sting a student. These bites and stings can sometimes cause violent reactions in some students who may be allergic to them. Signs and symptoms could include any of the following: puncture marks, anxiety, pale, cool skin with progressive onset of sweating, difficult swallowing and speaking, blurred vision, abdominal pain, rapid or weak pulse, rapid or shallow breathing, breathing difficulties, nausea and or vomiting, headache, intense pain at sight of bite, and localized redness and swelling. The care and treatment is very simple. Apply direct pressure over the bitten area if there is bleeding. Find out if the student has allergies to bites or stings. If available, use a cool compress to reduce the swelling and have the student report to the school nurse for evaluation. Food allergies are not mentioned in the manual but need to be discussed. It is amazing how many students have allergies to food. There are students allergic to peanuts, nuts, wheat, milk, strawberries, cherries, dye or food coloring, and the list could go on. For everyone's safety, students should never be sharing food. Before giving food treats to students, it is very important for the bus driver to make sure that a student doesn't have any food allergies. Sometimes a student may have a severe allergic reaction that causes anaphylactic shock. There are many types of shock caused by a variety of circumstances, ranging from emotional crisis to massive blood loss. One of the most unusual and fast-acting types of shock is the type occurring from an extremely allergic reaction. This type of shock is called anaphylactic shock and is commonly caused by bee stings or food allergen ingestion. If a student experiences any allergic reaction of any kind, it may quickly turn into a life-threatening emergency. Anaphylactic shock can cause, within minutes, swelling in the airway to a degree an individual will not be able to breathe. Signs and symptoms include itching, red, raised, blotchy skin, better known as hives, wheezing, confusion, weakness, pale color, unconsciousness, unable to speak more than 1 or 2 words, sitting straight up with hands on knees, gasping for breath, pursing lips to breathe, and using neck muscles to take breaths. The only way this condition can be corrected is through medication. Many seriously allergic people always carry their own medication with them. One method of treating anaphylaxis is injection of epinephrine using an EpiPen auto-injector. What you can do is the following. If a reaction occurs, know all appropriate emergency numbers to call and use those numbers as quickly as possible. Call your dispatcher and report the situation and call 911 immediately as directed by the dispatcher. You can also consider having a food allergic child sit next to or near the driver and enforce the no food on the bus policy. Asthma is a respiratory condition in which the student suffers constricted passages in the lower airway and it becomes progressively more difficult to breathe. Asthma can be a life-threatening condition that can develop suddenly or over several days. Students with asthma are subject to unexpected severe attacks. Minor respiratory infections such as colds, flu, and seasonal changes can cause the condition to worsen. The signs and symptoms of an asthma attack could include any of the following: pale, cool, clammy skin, shortness of breath and using all the chest and diaphragm muscles to breathe, a wheezing or high-pitched raspy sound when breathing, anxiety, exhaustion. With severe asthma attack, the student could collapse, leading to eventual respiratory arrest. If a student is experiencing an asthma attack, call your dispatcher and report the situation. Sit the child comfortably upright, be calm and reassuring, and assist the student with locating their inhaler and allowing them to use the inhaler if they are able. Bites. Bites from other children are one of the most common first aid problems on a bus. For care and treatment, you need to know that the bite must be cleaned with antiseptic and a Band-Aid placed on the area. Report the biting incident to your supervisor and complete proper paperwork when required. The emergency we will cover next is choking. Younger children often put things in their mouth which may result in choking. The first sign may be coughing. Coughing will generally dislodge the object. If you have a student who is choking, do not slap them on the back. The signs and symptoms of choking are difficult or absence of breathing, inability to speak or cough, and agitation and distress, grabbing the throat and eventually collapsing. To care and treat someone who is choking, you need to stand behind the student and wrap your arms around the student's waist. Make a fist with one hand. Place the thumb side of the fist against the student's abdomen slightly above the belly button. Grab the fist with the other hand and press the fist into the student's abdomen with a quick upward thrust. Each new abdominal thrust should be separate and distinct movement. Repeat thrusts until the student expels the obstruction. Diabetes. Diabetes is a condition caused by an imbalance of sugar in the blood. Because all human cells require sugars as food, The body takes in complex sugars in a normal diet. For the body's cells can use these sugars, the pancreas makes a hormone called insulin, which attaches to the sugars. This allows the cells to recognize the sugar as food and absorb it. Unfortunately, this condition is becoming more and more prevalent among school-aged children. Students with type 1 diabetes and some students with type 2 diabetes require insulin to survive. It is not expected that you check students' blood glucose levels or administer insulin or glucagon, but that you may be able to recognize students for symptoms of high and low blood glucose and to assist the student in an emergency. Understand and be aware that although low blood sugar normally occurs at the end of the day, it can happen at any time throughout the day. The signs and symptoms of low blood sugar can include any of the following: hot, dry skin, smell of acetone, which smells like nail polish remover on the breath, drowsiness or change in mood, unconsciousness that progresses to a coma, sweating, shaking, dizziness, hunger, confused or aggressive behavior, irritable, may appear drunk, and impaired vision. To care for someone who's expecting low blood sugar, you should do the following. If they are conscious, give a sweet drink if available. Do not give diet soda or diet drinks. Some students carry candy such as Smartie or Skittles. Call the dispatch. If available, encourage ingestion of high carbohydrate foods. Some examples of high carbohydrate foods are granola bar, peanut butter crackers, and/or fruit snacks. Do not attempt to give an insulin injection. At the beginning of the school year, identify any students on the bus who have diabetes. Treat the diabetic student the same as you would any other student, except for your response to their medical needs and by also allowing them to eat snacks on the bus. Provide input to the student's school health team when requested. Communicate with the parents, school nurse, and/or trained diabetes personnel regarding any concerns about the student. As with any other student, respect the student's confidentiality and right to privacy. Nosebleeds. When a student's nose bleeds, there are some immediate things you can do to stop the bleeding. First, have the student stay upright in their seat and tilt their head forward a little. Have the child compress the nostril or pinch the nose for 5 to 10 minutes with a tissue. Dispose of the blood-contaminated tissue appropriately. Seizures often are a symptom of a variety of central nervous system problems, including epilepsy. There are several levels of seizure activity, but the type of seizure most important to you is when the student becomes unconscious. In addition to losing consciousness, the muscles of the person experiencing the seizure alternately flex and contract. This creates the jerking, sometimes violent motion. Your main concern is to maintain an open airway so the student can breathe and to protect the student from injuring themselves or others around them. If the student has a seizure, allow it to run its course and perform the following steps. Lay the student down if they're not already on the floor. Protect them from injury as much as possible by moving any possible objects the student could injure themselves on, and cushion their head with a sweatshirt or a soft book bag. Monitor the airway and position their body to permit the adequate exchange of air. Do not put your fingers or other objects in the student's mouth during a seizure. You will need to call dispatch and follow their directives. Most seizures are brief and may only last a minute or two. After the seizure is over, check their breathing if they're still unconscious. When consciousness returns after a seizure, the student may be confused and disoriented. Be very considerate of their emotional state, providing as quiet and private a recovery environment as possible. It is important to manage the other students around them. The manual doesn't mention vomiting, and as we all know, this happens. Hopefully students know that they should be telling you if they're feeling nauseated. Give them a convenience bag or bucket for them to use in case they throw up. If they do throw up on the way to school, upon arrival at the school, call the office and ask if they may send them into the health room. If a student gets a cut or a scrape on the bus, give the student gauze or a tissue and instruct them to hold pressure on the injury to control the bleeding. When the bleeding is controlled, it can be covered with a Band-Aid after it's disinfected. Remember to wear your gloves if you're assisting the student, and always remember to disinfect the surfaces on the bus that have come in contact with students' blood. Upon arrival to school, any student who needs immediate treatment for either bleeding, vomiting, or for treatment of their medical diagnosis, radio the school to verify if it's okay for the student to disembark and enter the building to report to the nurse. Students with a minor illness or with complaints of feeling sick need to disembark at their usual time and report to their homeroom teacher, who would determine if the student needs to report to the health room. If a student has a medical plan, the school nurse will be contacting the bus driver with the information as agreed upon with the parents. If you receive a copy of the medical plan, remember that it is to be kept in a safe place and that substitutes need to have access to the information. These plans are confidential, and when they're no longer in use, either when the student withdraws or at the end of the school year, they need to be shredded. Thank you for your attention today as we've covered a few medical concerns that our students deal with on the bus.